If you're over 65 and taking vitamin B12, what I'm about to share with you could genuinely save your life. And I mean that with every bit of medical experience I have, because there are three medications that millions of American seniors take every single day that can silently sabotage everything that vitamin B12 is trying to do for your body. And some of these combinations don't just reduce the benefits, they can actually make things dramatically worse in ways that most doctors never even warn you about. Maybe you've been feeling more tired than usual, or your memory hasn't been as sharp as it used to be, or you've noticed tingling in your hands and feet that just won't go away, and you've been told it's just part of getting older, but what if it isn't? What if the real problem is sitting right there in your medicine cabinet, quietly working against you every single day? I'm Dr. Sarah Brooks. I've been practicing medicine for over 20 years, and today I dedicate my work entirely to helping seniors live healthier, longer lives. And one of the most heartbreaking things I see in my practice is patients who are doing everything right, eating well, taking their supplements, following their doctor's orders, and still feeling terrible because nobody told them about these dangerous combinations that are completely undermining their health from the inside out. You are not alone in this. According to recent data, more than 40% of American adults over the age of 65 are deficient in vitamin B12. And that number climbs even higher when you factor in the medications that actively block absorption or interfere with how the body processes this critical nutrient. And here's what makes this so alarming. The symptoms of B12 deficiency develop so slowly, so quietly, that by the time most people realize something is wrong, the damage has already been building for months, sometimes even years. We're talking about nerve damage, cognitive decline, dangerous anemia, and in severe cases, irreversible neurological problems that can rob you of your independence and your quality of life. So, today I'm going to walk you through exactly which three medications you need to be extremely careful about, why they interfere with B12 at the biochemical level, what you can do about it, and how to protect yourself starting today, because every single day matters when we're talking about your brain, your nerves, and your long term vitality. If any of this sounds familiar, go ahead and hit that thumbs up button right now, because this information needs to reach every senior across America who deserves to know the truth. Now, before I get into the three medications, I want you to understand why vitamin B12 is so absolutely critical for people over 65, because once you understand what it does in your body, you'll truly grasp why blocking it is so dangerous. Vitamin B12 is involved in the production of myelin, which is the protective sheath that surrounds your nerve fibers. And when you think about that, think of it like the rubber insulation around an electrical wire, because without that insulation, the electrical signals in your nervous system start to misfire, short circuit, and break down, and that's when you start feeling that numbness, that tingling, that burning sensation in your hands and feet that so many of my patients describe. But it goes even further than that, because B12 is also essential for the production of red blood cells, which carry oxygen to every single tissue in your body, including your brain. And it plays a direct role in DNA synthesis and the regulation of homocysteine, which is an amino acid that, when elevated, has been directly linked to increased risk of stroke, heart disease, and Alzheimer's disease. And I know that those are words that nobody wants to hear, but the science is absolutely clear on this, and it's why I feel so strongly about making sure every one of my patients understands how to protect their B12 levels. Now, here's something that many people don't realize, and it's a crucial piece of the puzzle. As we age, our bodies naturally produce less stomach acid and less of a protein called intrinsic factor, which is absolutely necessary for B12 absorption in the gut. And that means even if you're eating plenty of B12, rich foods like eggs, meat, dairy, and fish, your body may not be absorbing nearly as much as it needs. Which is why supplementation becomes so important after 65, but also why the medications I'm about to tell you about are so particularly dangerous for older Americans, because they're hitting a system that's already operating at a disadvantage. So let's talk about the first medication, and this one is going to surprise a lot of you because it's one of the most commonly prescribed drugs in America, and hundreds of millions of prescriptions are written for it every single year. I'm talking about metformin, the number one medication prescribed for type 2 diabetes, and if you or someone you love is managing diabetes after 65. Please pay very close attention to what I'm about to share because the connection between metformin and B12 depletion is something that most patients are never told about, and the consequences can be absolutely devastating. Research has shown, and I'm talking about large scale clinical studies published in respected medical journals, that long term metformin use significantly reduces the absorption of vitamin B12 in the gut. And we're not talking about a small reduction here. Studies have found that somewhere between 10 and 30% of people taking metformin develop measurable B12 deficiency over time, and the longer you've been on the medication, the greater the risk. The mechanism behind this is fascinating and important to understand because metformin appears to interfere with the calcium dependent absorption process that allows B12 to bind to intrinsic factor in the small intestine, essentially blocking the pathway that your body uses to pull B12 out of food and supplements and into your bloodstream. Now, here's what makes this particularly cruel. The symptoms of B12 deficiency caused by metformin look almost identical to the symptoms of diabetic neuropathy, which is nerve damage caused by uncontrolled blood sugar. And so, when a diabetic patient on metformin starts experiencing tingling in their feet, weakness in their legs, or cognitive changes, their doctor may assume it's the diabetes progressing rather than a B12 deficiency caused by the medication. And that means the real problem goes unaddressed while the patient continues to suffer and the nerve damage continues to progress. I had a patient, a 73-year-old gentleman from Georgia named Harold, who had been on metformin for 11 years, and he came to me complaining of what he called walking through mud, this heavy, uncertain gait, along with memory lapses that his family had been worried about for months. His previous doctor had attributed everything to his diabetes and age, but when I ran a comprehensive blood panel, his B12 levels were critically low. We addressed the deficiency with supplementation and dietary changes, and within 3 months, Harold told me he felt like himself again for the first time in years. That's the power of identifying this connection early. If you're taking metformin, I strongly encourage you to talk to your doctor about having your B12 levels checked regularly, at least once a year, and to discuss whether B12 supplementation is appropriate for you. The good news is that this is a manageable situation once you know about it, and some research suggests that taking calcium supplements alongside metformin may help improve B12 absorption. Though you should always consult your healthcare provider before making any changes to your regimen. Now let's move to the second medication, and this one affects an enormous number of American seniors, particularly those dealing with heartburn, acid reflux, or what doctors call GERD, which stands for gastroesophageal reflux disease. I'm talking about proton pump inhibitors, or PPIs, which include some of the most widely used drugs in America with brand names like Prilosec, Nexium, Prevacid, and Protonix, and their generic equivalents. And if you've been taking one of these for years, which so many seniors have, you need to understand what's happening to your B12 levels because of it. Proton pump inhibitors work by dramatically reducing the amount of stomach acid your body produces. And for people suffering from painful acid reflux, that sounds like a great thing. And in the short term, it absolutely is because it provides real relief from a genuinely uncomfortable and sometimes dangerous condition. But here's the problem. Stomach acid is one of the critical components your body uses to release B12 from the food you eat. When you eat a piece of salmon or a hard-boiled egg, the acid in your stomach breaks down the proteins that B12 is bound to, freeing it so that intrinsic factor can grab it and carry it through your intestinal wall into your bloodstream. When you dramatically suppress that acid with a proton pump inhibitor, you impair this first crucial step, and the B12 stays trapped, unable to be released and absorbed, and this happens day after day, meal after meal, year after year. The FDA actually updated the safety communication for proton pump inhibitors specifically to note the risk of hypomagnesemia and B12 deficiency with long-term use. And research has shown that people who take PPIs for 2 or more years have a significantly higher risk of B12 deficiency compared to those who don't take them, and again, in a senior population where absorption is already compromised by aging. This compounding effect can be really serious. According to research published in the Journal of the American Medical Association, long-term PPI use was associated with a 65% increased risk of B12 deficiency. which is a staggering number when you think about how many seniors are on these medications long term, often for years without reassessment. Now, I want to be very clear. I'm not telling you to stop taking your medication without talking to your doctor, because acid reflux can have serious consequences, including esophageal damage and increased cancer risk if left untreated. And that's not a decision to make on your own. What I am telling you is that you deserve to have an informed conversation with your healthcare provider about monitoring your B12 levels if you're on long term PPI therapy, about whether the lowest effective dose is being used, and about whether your continued need for the medication has been reassessed recently, because many patients are initially prescribed PPIs for a short term issue and then end up on them for years without anyone revisiting that decision. There's also some practical dietary wisdom here that can help, and this is something I love sharing with my patients because it's simple, accessible, and completely within your control starting today. Foods that are naturally high in B12 and that provided in forms that are somewhat more bioavailable even in low acid environments include nutritional yeast, fortified cereals, and certain types of fish. And these are things you can find at any Walmart, Kroger, or grocery store across America, and incorporating them more intentionally into your daily diet is a step you can take right now. If this information about these medications is opening your eyes to something you didn't know before, please give this video a thumbs up right now, because that single click helps us reach more seniors who need this information, and it really does make a difference. Now, I want to talk about the third medication, and this one might be the most surprising of all because it's not a prescription drug. It's something that millions of Americans take voluntarily, often daily, believing it's helping their health, and in many ways it is, but the interaction with B12 is real and it's significant. I'm talking about antacids, particularly those containing calcium carbonate or aluminum and magnesium hydroxide, brand names like Tums, Rolaids, Maalox, and Mylanta, which are available over the counter at every pharmacy and grocery store in the country, and which many seniors use multiple times a day for heartburn and indigestion relief. Now you might be wondering, these are just antacids. How serious can this really be? And I understand that reaction completely because they seem so mild and harmless, and for occasional use, they largely are. But when seniors are using these products multiple times daily, which is extremely common, a few important things start to happen that can significantly impact B12 status. First, like the prescription PPIs I just described, antacids work by neutralizing stomach acid, and as we discussed, that acid is essential for releasing B12 from food, so chronic antacid use creates a similar problem, reducing the acidic environment that B12 absorption depends on. Second, some research suggests that high calcium intake from calcium carbonate antacids like Tums, when taken at the same time as B12 supplements or B12 rich meals, may actually interfere with the calcium dependent pathway that intrinsic factor uses to facilitate B12 absorption in the small intestine. There's also a third issue that's particularly relevant if you're taking metformin, which we discussed first, because some studies have actually found that taking calcium supplements can help counteract metformin's interference with B12 absorption. But if you're taking calcium carbonate antacids in high doses at the wrong times, you may be disrupting that balance in unexpected ways, which highlights just how complex these interactions can be and why individualized guidance from your healthcare provider is so important. Now, here's the practical wisdom I want to share with you about antacids and B12. Timing matters enormously. If you're going to take antacids, try to avoid taking them at the same time as your B12 supplement or at the same time as a meal that's your primary source of B12. Separating these by at least 2 hours can significantly reduce the potential for interference and help ensure your body has the best possible chance of absorbing the B12 it needs. I also want to mention something about antacid use that goes beyond B12 because many of my patients don't realize this. Chronic heartburn and the need for daily antacids is often a symptom of an underlying issue that deserves proper evaluation. Whether that's diet-related, structural, related to H, pylori infection, or something else entirely, and addressing the root cause rather than just managing the symptom daily with antacids is something worth discussing with your primary care doctor, especially if you're going through multiple rolls of Tums every month. Now, I want to share with you Dr. Brooks' B12 protection protocol, and this is a practical, actionable guide you can start using right away to protect your B12 levels and ensure your body is getting everything it needs to keep your nerves healthy, your mind sharp, and your energy strong. And the beautiful thing about this protocol is that everything in it is simple, affordable, and available right at your local CVS, Walgreens, or grocery store without a prescription. The first thing I recommend is getting your B12 level tested. This is a simple blood test that your primary care doctor can order, and it's especially important if you're on any of the three medications we discussed today. Normal B12 levels in adults are generally considered to be between 200 and 900 picograms per milliliter, but many functional medicine practitioners prefer to see levels above 400 in seniors for optimal neurological health, and some experts recommend levels closer to 500 to 600 for people with risk factors. Know your numbers so you have a baseline to work from and can track any changes over time. The second element of the protocol involves choosing the right form of B12 supplementation because not all B12 supplements are created equal, and this matters more than most people realize. The most common form found in supplements is called cyanocobalamin, which is synthetic and must be converted by your body into the active forms it can actually use, and for some people, particularly older adults and those with certain genetic variants, this conversion process doesn't work as efficiently as it should. The forms I tend to recommend for seniors are methylcobalamin and adenosylcobalamin, which are the naturally occurring, bioactive forms that your body can use directly without conversion, and they're readily available at health food stores and pharmacies across America. Another excellent option for seniors, particularly those with absorption issues related to reduced stomach acid or intrinsic factor, is sublingual B12, which dissolves under your tongue and enters the bloodstream directly through the mucous membranes, bypassing the gastrointestinal absorption pathway entirely and making the medication interactions we discussed much less relevant. This is genuinely one of the most important tips I can share for anyone who's been on metformin or PPIs for a long time. The third element of the protocol is dietary. Prioritize B12 rich foods in your daily eating and aim to have at least one or two servings of these foods every day. Excellent sources include grass-fed beef and beef liver, which are the most concentrated dietary sources of B12 available, wild-caught salmon and tuna, which are wonderful options and which most Americans enjoy and can find easily at any grocery store, eggs, especially the yolks, Greek yogurt, and other dairy products. Clams and oysters, which might surprise you with just how incredibly concentrated they are in B12, and nutritional yeast, which is a great option for those who prefer plant-based eating and which has a pleasant cheesy flavor you can sprinkle on soups, salads, and eggs. The fourth element involves smart supplementation timing. If you're taking any of the medications we discussed, work with your healthcare provider to time your B12 supplementation and your B12 rich meals strategically. Ideally separated from your medication doses by at least 1 to 2 hours where possible, and consider taking your B12 supplement in the morning before your antacid or PPI if your schedule allows. Now, I want to go deeper on something that I think is critically important and that ties everything we've discussed together. And it's the question of how you know whether you might already have some degree of B12 deficiency. Because the symptoms are genuinely easy to miss or to attribute to other things, especially as we get older and we're told that fatigue and memory changes and physical discomfort are just part of aging. And I want to push back on that narrative because while some changes are normal with age, many of the symptoms of B12 deficiency are absolutely not something you just have to accept and live with. The early warning signs of B12 deficiency include persistent fatigue and weakness that doesn't improve with rest, a feeling of brain fog or difficulty concentrating that comes and goes, mood changes including increased irritability, depression, or anxiety, tingling or numbness in the hands and feet, which doctors call peripheral neuropathy, a sore or inflamed tongue, difficulty with balance and coordination, and pale or slightly yellowish skin. As the deficiency progresses without treatment, symptoms can become more severe and include memory loss and cognitive impairment, difficulty walking and maintaining balance, vision disturbances, and in advanced cases, psychiatric symptoms including paranoia and hallucinations. And I mention these not to frighten you, but because these are real. Documented consequences of severe B12 deficiency that are entirely preventable with early detection and appropriate intervention. Research indicates that B12 deficiency is significantly underdiagnosed in older adults because its symptoms overlap with so many other conditions common in aging, including anemia from other causes, hypothyroidism, depression, early dementia, and peripheral neuropathy from diabetes. And this overlap is one of the main reasons why I advocate so strongly for regular B12 level testing as part of routine senior health monitoring, particularly for anyone on the medications we've discussed today. According to studies, seniors over 65 are among the highest risk groups for deficiency, and the risk increases with age and with the combination of medications and reduced physiological absorption capacity that characterizes aging. I want to share another patient story with you because I think stories help make this real in a way that statistics sometimes can't. I had a patient named Dorothy, a 78-year-old retired schoolteacher from Tennessee, and she came to see me because she had been struggling with what she described as increasingly severe depression and what she thought might be the early stages of dementia. Her memory had been slipping. She felt disconnected from the things she used to love. She was having difficulty following conversations, and her family was deeply worried about her. She had been on a proton pump inhibitor for 7 years for acid reflux, and she was also taking a calcium carbonate antacid daily. Her previous physician had recommended an evaluation for Alzheimer's disease. When I tested her B12 level, it was critically low, significantly below the normal range. We began aggressive B12 supplementation with high-dose sublingual methylcobalamin, made strategic dietary changes, and worked with her gastroenterologist to reassess her need for the PPI and explore the lowest effective dose. Within 6 months, Dorothy described the experience as a fog lifting. Her memory improved dramatically, her mood stabilized, her family said they had their mother back. Dorothy's story is not unusual, and that's both the beautiful and the heartbreaking part of this work, because so many seniors are suffering unnecessarily from something that is absolutely addressable once the right questions are asked. Now, I want to address something important about the American healthcare system and why this information often doesn't reach seniors the way it should, because I think it's important to be honest about this. The reality is that a typical primary care appointment in the United States lasts between 15 and 20 minutes on average, and in that time, a doctor is managing multiple concerns, reviewing multiple medications, addressing acute symptoms, and handling preventive care and the nuanced conversation about B12 and medication interactions, about optimal versus technically normal levels, about timing and supplement forms, about the difference between cyanocobalamin and methylcobalamin, simply. Doesn't make it into that 15-minute window most of the time. This isn't a criticism of doctors, who work incredibly hard under real systemic constraints, but it is a reality that means you as a patient need to be your own advocate and come to your appointments prepared with specific questions. Write in the comments right now, which of these medications are you currently taking? Are you on metformin, a proton pump inhibitor, or antacids? Your comment could help someone else watching this video today, and it helps me understand what information is most important for our community. So please take 30 seconds and share your experience below. Here are the specific questions I recommend you bring to your next appointment with your primary care doctor, and I want you to write these down or screenshot this part of the video. Ask your doctor, what is my current B12 level, and what has it been over the past several years? Am I taking any medications that are known to deplete or block B12 absorption? Given my age and medication list, would B12 supplementation be appropriate for me, and if so, what form and dose would you recommend? Is there a way to time my medications and supplements to minimize any interactions? And finally, is my continued use of this medication still necessary at the current dose, or might there be alternatives worth discussing? Those questions alone can open a conversation that genuinely changes your health trajectory, and I mean that sincerely because informed patients who come to appointments with specific questions consistently get better outcomes than those who don't. If you want access to exclusive content, including more detailed home remedy protocols, in-depth guides on managing medication interactions naturally, and personalized health advice specifically designed for seniors. I invite you to become a member of our channel, and I share considerably more detailed information there specifically for our members, including downloadable guides you can bring to your doctor's appointments.